Hey, we're here with Dr. Bilski again, and I'm just going to get right into this. Bridges. I don't know anything about dental bridges, and I hope I don't ever have to, but if I do, what can I expect?
So, geez, if you just drive through the county anywhere, there's different types of bridges, right?
Sure are.
Yeah.
Covered,
uncovered.
rusty, good ones, bad ones?
Bad ones, leaky ones, broken ones.
You're setting me up because it can be the same thing with what I may have in my mouth one day.
So what they all have in common is you have to have maintenance.
Yeah. Okay.
And the principle of what most people call a bridge and identify. Some patients will call their removable bridge, which we call a partial denture. So it has little clips, looks like a retainer with teeth on it. That is called a removable partial denture, RPD, okay? The fixed bridge is kind of what we're alluding to here. That is a more natural type of what we call a long-term restoration. These fancy doctor terms for you have teeth to smile with that you can chew with, that stay in your mouth, you brush, you floss, or you water pick, or all of the above, hopefully. And feels very natural. It doesn't come out of your mouth. The removable partial dentures, RPDs, are more artificial looking. You know, you can get some nice dentistry done with that. However, they should be taken out and put in the jar after cleaning. So it really depends on what is affordable for you, which we don't judge there. We're just trying to get a result that you want.
Yeah.
And a fixed bridge is a little bit more costly, and there's a little bit more involved. So we have to reshape some teeth, and we use them literally like, think of a fence. You have a post and a post, and the pickets in between would be the teeth, and then those are bonded into place with typically a material that's an acrylic in nature that helps thermally insulate. So hot and cold usually does not bother the teeth. All right, they look great. They're very durable. They can last you for a long time, except if you don't maintain it.
What is maintaining? And is that a little different depending on what kind of bridge you have, or?
It is so age dependent. How long the bridge has been in place.
Right.
How is your oral hygiene care at home? What is your lifestyle? If you have a high sugar diet,
poor
hygiene,
that makes sense.
You may be seeing me more often to replace the bridge. But I've been doing this 35 years. I have bridges that I placed 30 years ago.
Oh, is that right? Well, see, that's great.
They're still in place.
That's fantastic. You got to bring those folks. You should bring those folks back sometime. We should have them on a video.
Like let them eat corn on the cob and steak.
Right? Yeah,
show them
right.
how to do that. Yeah, and there are some that don't have the best oral hygiene care at home. They're just not doing what they're supposed to be doing. They forget their dental appointment to come in for a cleaning. Rule of thumb is when you have a bridge, we're going to ask you to come in at least one extra time a year, meaning instead of 2 times a year, we ask you to come in 3 times a year. That doesn't mean an exam with x-rays. It just means sit with the hygienist, Pam or Danielle, who work for me, and they take a look and they clean it. So if we do see something that needs a little bit of maintenance more than the typical, then we can take care of it right there. We're not remaking bridges, which takes a lot of time and money, and maybe won't be covered in a certain period of time from the dental insurance company.
With 35 years of doing that, obviously successful, I've got a new tagline for you guys.
What's that?
It's where George Washington would have gone if you guys would have been, because, you know, how would you take care of wooden teeth? How would you suggest taking care of those? Varnish once a year, twice a year?
That will be on the next video.
Okay.
We'll have a little chat with Randy.
Okay, but don't worry. You know, George, that was a long time. I had to bring, because as we're shooting this, it's kind of close to President's Day.
For sure, yeah.
You don't have to worry about those kind of bridges, and I won't either, because the new dentistry is wonderful, and you can make sure the bridges are working the way they should and maintain the way they should. So
I think there's just go to our website at bilskidental.com, and there's a lot of little tutorials or little vignettes that patients have talked about, or just leave us a message, and certainly someone will contact you or maybe even me.
Right. Well, thanks for sharing that.
Yeah, thank you.